Welcome to this week's Al-Ghaf Dynamics HealthConnect Middle East podcast episode. This week, we will be discussing major developments and events over the past 7 days in the Middle East region across healthcare, public health, life sciences, and wellness. Areas that are not only important to the Middle East population, but to the regional ministries, organizations, hospitals, pharmaceuticals, biotech, and wellness groups. You will hear trends, insights, and the latest developments across the Middle East region for the week leading up to August 21, 2025. As always, our information is drawn from regional health ministries, pharma and biotech institutions, advanced data and news outlets coupled with our internal data and analytics platform, HealthConnect Middle East. This week in the Middle East, developments spanned ambitious government initiatives, cutting-edge research milestones, and persistent public health challenges. Regional governments accelerated health sector reforms, from UAE and Oman strengthening preventive care frameworks to Iraq launching a new national health strategy. In the Gulf, investments in life sciences and digital health continue to gain momentum, exemplified by local innovations and cross-border collaborations in Saudi Arabia, Kuwait, and Bahrain. At the same time, areas like Gaza and Yemen faced ongoing crises, with healthcare systems under extreme strain even as international agencies pressed for support. Across the 14 countries of the region, spanning the Gulf, Levant, and beyond, a dual narrative emerged, one of proactive health policy and innovation driving future wellness, and another of urgent humanitarian needs demanding resilience. First, our healthcare policy and government initiatives from the past week. UAE strengthening preventive care and partnerships. The UAE Ministry of Health and Prevention, MOHAP, convened public and private hospitals in a major push to standardize and enhance the national newborn screening program. In meetings held in Dubai, MOHAP emphasized strict adherence to new federal legislation on newborn medical screening, including uniform protocols for genetic, hearing, and cardiac tests for all newborns. The initiative integrates Riyadh, the UAE's digital medical record platform, to improve early detection and data sharing, aligning with cabinet directives on preventive health. MOHAP underscored that protecting infant health is a strategic national priority and touted the public-private partnership as a strategic ally in achieving UAE health goals. By bolstering regulatory oversight and collaboration, the UAE aims to promote a culture of disease prevention and ensure high-quality care from birth. Oman launch of National Health Policy. The Sultanate of Oman officially rolled out its National Health Policy 2025 framework, marking a significant step toward health for all, by all. The policy, launched under ministerial patronage, sets a comprehensive strategy to strengthen Oman's health system in line with Vision 2040. It emphasizes intersectoral cooperation, community engagement, and shared responsibility for public health. Key pillars include a One Health approach across sectors, prioritization of primary care, and robust health governance to attract and retain skilled professionals. Private sector partnership is explicitly encouraged to invest in and enhance healthcare delivery. By mobilizing all resources, government, private, civil society and families, Oman's policy seeks to ensure equitable, comprehensive services and high standards nationwide. Public health promotion and disease prevention are central, with the new policy positioning Oman to improve population well-being while bolstering its regional health leadership. Saudi Arabia international collaboration and healthy cities. Saudi Arabia pursued high-profile health diplomacy and received global recognition for its health initiatives. Health Minister Fahd Al-Jalajel embarked on an official visit to Australia aimed at strengthening bilateral cooperation in healthcare, digital innovation, and investment. During the mid-August trip, he met Australian officials and toured hospitals and research centres to exchange expertise on health technologies, emergency services, and medical training. Domestically, Saudi authorities celebrated a milestone as 16 Saudi locations earned WHO Healthy City accreditations for meeting rigorous health and sustainability criteria. Notably, Jeddah and Medina became the first Middle Eastern cities over 2 million people to be certified as healthy cities, reflecting successful cross-sector collaboration to improve quality of life. These achievements align with Saudi Vision 2030's vibrant society goals, underscoring government commitment to integrated health planning. Together, the kingdom's global outreach and local initiatives are enhancing its profile as a regional healthcare leader, while forging partnerships to import best practices in public health and innovation. Qatar Regulatory Oversight and Safety Enforcement. Qatar's Ministry of Public Health, MOF, took decisive regulatory action to uphold healthcare standards. On August 14, MOF announced the immediate closure of a private medical center in Doha for failing to meet the required minimum staffing of qualified specialists. In a parallel case, authorities shut down an obstetrics and gynecology unit at another private clinic and suspended a practitioner's license for operating beyond their authorized scope. These enforcement measures are part of MOF's ongoing compliance inspections to ensure patient safety and adherence to national health laws. The ministry reiterated that all facilities must fulfill licensing requirements and maintain quality care, highlighting its zero-tolerance stance on violations. By tightening oversight of the private sector, Qatar aims to protect healthcare consumers and uphold confidence in medical services. The swift sanctions this week signal the government's commitment to robust health governance and accountability. Iraq and Jordan, strategic health sector reforms. In Iraq, policymakers advanced a transformative agenda for healthcare. Working with the World Health Organization, WHO, and UN partners, Iraq launched a 2025 to 2030 national strategy for women's, children's, and adolescents' health. Unveiled in Baghdad with full government support, the strategy places population needs at the center of health policy and is backed by a budgeted action plan. It prioritizes expanding essential services to rural and conflict-affected areas, standardizing care nationwide, and upgrading health infrastructure. WHO's Iraq representative praised the plan as a landmark commitment to building a resilient system that protects the most vulnerable groups. Meanwhile, Jordan signaled high-level support for healthcare improvements through diplomatic and investment channels. Jordanian Health Minister Dr. Ibrahim Al-Bidour met with his Iraqi counterpart in Oman to discuss deepening bilateral cooperation in health, coinciding with a regional health board meeting in the capital. Although earlier in the summer, Jordan also secured nearly $187 million in foreign investment agreements to modernize its health infrastructure and digital systems, including constructing a new government hospital and digitizing military medical services. These efforts, endorsed by Jordan's Prime Minister and regional investors, are set to strengthen hospital capacity and health IT in the kingdom. Through such strategic initiatives, both Iraq and Jordan are working to fortify their healthcare delivery and regional partnerships. Egypt expanding healthcare access. Egypt's government showcased tangible results from its ongoing campaign to improve public healthcare access and quality. The Health Ministry reported that in the first half of 2025, public hospitals provided over 30 million medical and therapeutic services to citizens. This includes millions of imaging scans, 4.4 million X-rays, CTs, MRIs, and others, and tens of thousands of advanced procedures, such as 733,600 surgeries and 150,745 dialysis sessions, performed between January and June. Intensive care was delivered to 131,600 critically ill patients, and nearly 50,000 newborns received specialized care in neonatal units during the period. Officials attributed these impressive numbers to the government's 100 Days of Health initiative, a nationwide campaign launched in July to provide free checkups and treatments and sustained investments in hospital upgrades and staff training. The Health Ministry has also organized dozens of training programs for medical staff in infection control, maternal care, and other fields to boost service quality. By aggressively expanding free services and modernizing facilities, Cairo is moving toward its goal of comprehensive healthcare coverage. The Prime Minister has lauded these efforts as key to alleviating the burden on citizens and elevating healthcare standards across all governorates. Now we have life sciences and research innovation. Saudi Arabia Research Recognition and Healthy Cities Program. Saudi Arabia's drive to become a scientific and medical research hub gained international notice this week. A pioneering study by surgeons at King Faisal Specialist Hospital and Research Center on robotic liver transplantation was honored as one of the 10 most influential research papers of 2024 by the American Society of Transplantation. This accolade reflects the kingdom's growing output of high-impact clinical research and innovation. At the same time, Saudi communities reap the benefits of research-informed public health initiatives. The Ministry of Health confirmed that 16 Saudi localities have now met WHO Healthy City criteria, recognizing achievements in areas like urban planning for wellness, environmental health, and disease prevention. Jeddah and Medina's new WHO accreditations, in particular, underscore how evidence-based programs can improve population health on a large scale. These advances are closely tied to Vision 2030's emphasis on quality of life and a knowledge-based economy. By investing in cutting-edge medical research and community health projects, Saudi Arabia is steadily cementing its global standing in healthcare science and innovation. Kuwait International Research Partnership. Kuwait took a significant step to bolster its health research capabilities through a new international collaboration. The Kuwait Pharmaceutical Association, KUPHA, signed a strategic memorandum of understanding with the University of Reading, UK, to establish joint research programs aimed at improving healthcare outcomes. Formalized in June and highlighted this week, the partnership has already led to the creation of a dedicated health services research, policy and innovation unit in Kuwait, co-led by experts from Reading and KUPHA. This unit will focus initially on pharmacy practice research and health policy studies, generating high-quality scientific publications to inform evidence-based health policies across the Middle East. It will also facilitate staff and student exchanges and collaborative grant applications, effectively building Kuwait's research capacity and global linkages. Kuwaiti officials expressed confidence that the partnership will expand the country's cadre of specialized pharmacists and increase its scientific output. By tapping into international academic expertise, Kuwait aims to drive innovation in its healthcare system and contribute to regional knowledge, an approach that demonstrates the growing emphasis on research-driven health reforms in the Gulf. Egypt, boosting biomedical research and standards. Egypt advanced a unique public sector collaboration to strengthen biomedical R&D and quality standards. On August 21, the Egyptian Organization for Standardization and Quality, EOS, inked a cooperation agreement with the Armed Forces Center for Research and Regenerative Medicine, ECRM, to coordinate on biomedical technology development. The cabinet announced protocol covers joint scientific research, specialist training, and knowledge exchange in areas like laboratory accreditation, medical product safety, and biobanking. EOS Chairman Khaled Soufi noted the partnership will link scientific research with global standards, for example, leveraging biobank resources to advance medical studies while preserving biological samples safely. A key aim is to ensure new health innovations meet international quality benchmarks, thereby protecting patients and enhancing Egypt's health industry competitiveness. The initiative aligns with Egypt's Vision 2030, reflecting a strategic intent to raise the country's regional and international profile in biomedical science. By uniting civil and military research institutions, Egypt hopes to accelerate technological development, such as in regenerative medicine, and bring high-quality medical solutions to market for the benefit of its population. This model of standardization-driven innovation could bolster Egypt's capacity for breakthroughs while ensuring safety and efficacy remain paramount. Bahrain and Gulf, genomic and AI innovations. The Gulf region continue to invest in frontier health sciences, particularly in genomics and artificial intelligence. Bahrain recently increased its gene sequencing capacity to 20,000 whole genomes per year, roughly 2.5 times its previous throughput. This expansion positions Bahrain as a regional player in genomic medicine, allowing researchers to identify hereditary disease risks and personalize treatments at scale. Similar genome initiatives are underway in the UAE and Saudi Arabia as part of national precision medicine programs. Meanwhile, artificial intelligence, AI, is being progressively integrated into Middle Eastern healthcare. In Kuwait, doctors at Jabba Hospital have begun using advanced 3D modeling and AI-assisted systems in clinical practice, notably performing the Gulf region's first endoscopic surgeries guided by AI to detect colon and stomach tumors that would be hard to spot with the naked eye. The introduction of this Olympus 3D endoscope and AI diagnostic tool in 2023 marked a first-of-its-kind surgical innovation in Kuwait, improving visualization and accuracy during procedures. Such local adoption of AI and machine learning in medicine is expected to grow rapidly. Across the region, governments and private stakeholders are increasing research funding for digital health solutions, as studies indicate that widespread digital health adoption could unlock tens of billions of dollars in economic benefits by 2030. The convergence of genomics and AI in Middle East healthcare R&D signals a transformative period ahead, with the potential to dramatically improve disease prevention, diagnosis, and treatment through data-driven precision. Let's turn to biotech and pharmaceutical developments. Saudi Arabia regulatory milestone for medtech innovation. In a boost to local medtech innovation, the Saudi Food and Drug Authority, SFDA, granted approval to a new surgical device developed domestically in Saudi Arabia. Announced on August 21, the device is a hand-worn surgical tool with a magnetic needle holder designed to improve surgeon safety and efficiency during suturing. By allowing surgeons to securely park suture needles on the back of the hand, it frees both hands for knot tying and significantly reduces the risk of accidental needle stick injuries in the operating room. The innovative device was created by researchers at King Saud University and is protected by patents in Saudi Arabia and the United States. Before approval, the SFDA rigorously evaluated technical documents and clinical data to ensure the tool's safety and effectiveness. This project was facilitated by SFDA's Innovative Medical Devices Pathway, launched in 2021, which provides Saudi inventors with regulatory guidance and support. The successful approval highlights the payoff of that program and represents a significant milestone in localizing high-tech medical manufacturing. It also aligns with the Kingdom's Vision 2030 health sector transformation goals by fostering homegrown innovation and moving towards self-sufficiency in medical supplies. Saudi officials noted that bringing production in-country will enhance surgical safety and reinforce the nation's reputation as a growing contributor to global medical R&D. Egypt ensuring quality in pharmaceuticals. Egypt continued efforts to improve the quality and safety of medical products through enhanced standards and coordination, as evidenced by the EOS-ECRM protocol described above. The new partnership is explicitly aimed at ensuring safe, high-quality medical products for Egyptians through better enforcement of international standards. Joint teams will work on laboratory accreditation and compliance, which is expected to help Egyptian pharmaceutical and biotech products meet global benchmarks and facilitate exports. Additionally, the cooperation will address good research practices and even sustainable medical tourism, indicating a broad vision to integrate quality into all aspects of healthcare and biomedical enterprise. This initiative complements other recent moves by Cairo to develop its pharmaceutical sector, for instance, establishing new insulin production lines and vaccine manufacturing facilities in partnership with international firms, ongoing projects under Egypt's National Pharmaceutical Industry Development Plan. By unifying national efforts under a quality umbrella, Egypt seeks to protect patients while also making its health industries more competitive and innovative. Regional industry updates. In other industry news, Gulf countries saw increased activity in the weight management drug segment that has drawn global attention. For example, Novo Nordisk's blockbuster obesity drug Wegovy, semaglutide, received an FDA accelerated approval in the United States for a new indication, treating a form of liver disease, a development closely watched by Middle Eastern markets where obesity and related metabolic disorders are prevalent. In fact, Saudi Arabia has been working with Novo Nordisk to localize semaglutide production through a partnership with the public investment fund's Lifera company. Plans are on track for Novo Nordisk to introduce Wegovy in the Saudi market in late 2025, with local manufacturing to follow, thereby improving access for Gulf patients while developing local biopharma capacity. Meanwhile, regulatory agencies in the region continue to approve cutting-edge therapies. For instance, the UAE and Saudi FDA have in recent months fast-tracked approval of new diabetes and oncology drugs, keeping regional formularies up to date with international standards. Across the Middle East, the trajectory is clear. Governments are not only purchasing advanced medications for their populations but also seeking technology transfer and local production deals to build a sustainable pharmaceutical ecosystem at home. Public health challenges and disease outbreaks had key developments. Kuwait, toxic alcohol poisoning outbreak. Kuwait faced a deadly public health incident as dozens of expatriate workers suffered methanol poisoning from illicitly brewed alcohol. In the 5 days up to August 13, 63 people were hospitalized with methanol toxicity, of whom 13 died and 21 were blinded or suffered severe vision loss. The Kuwaiti Ministry of Health reported that all the victims were of Asian nationalities and had consumed contaminated bootleg spirits. Over 50 patients required emergency dialysis for kidney failure and 31 needed mechanical ventilation due to the poisoning's severity. Kuwait strictly bans alcohol, but an underground market of secret distilleries exists without any safety oversight, leading to periodic poisoning tragedies. This week's mass casualty event, one of the worst in recent memory, prompted a swift response. Authorities announced the arrest of at least 67 people involved in illegal alcohol production and the shutdown of 10 makeshift distilleries linked to the tainted brew. Health officials warned the public of the extreme dangers of consuming unregulated beverages and worked with hospitals to ensure adequate antidotes and supportive care were available for the influx of patients. The incident underscored gaps in enforcement of alcohol prohibitions and the need for stronger public awareness among at-risk communities. By week's end, Kuwait's health ministry indicated the situation was under control, though the toll on lives and health was already substantial. Saudi Arabia MERS cases persist. Saudi health authorities reminded the region that Middle East respiratory syndrome, MERS, remains a lurking infectious threat. The kingdom notified international observers of a new confirmed MERS-CoV case in Saudi Arabia in early August, bringing the country's total in 2025 to 11 cases, with 2 deaths reported so far this year. While no large outbreak was reported this week, the detection of sporadic cases, often linked to contact with camels, the virus's host reservoir, keeps public health surveillance on alert. According to WHO Eastern Mediterranean reports, as of mid-August the overall risk of sustained human-to-human MERS transmission remains low, but clusters can occur, particularly in healthcare settings. The Saudi Ministry of Health continues to implement preventive measures such as infection control in hospitals and public advisories for avoiding raw camel products, given the country's historical burden of the disease. Regional experts point out that the gradual trickle of MERS cases is a reminder of zoonotic disease challenges in the Middle East. On a positive note, research collaborations are ongoing. A Saudi-UK trial of a MERS vaccine, the VTP-500 candidate, completed Phase 1 recently, feeding hope that a vaccine might eventually be available for high-risk groups. For now, vigilance is key. Neighboring countries like Oman, Qatar, and UAE also maintain surveillance since past cases have crossed borders. The public is regularly cautioned, especially those working with camels, to report respiratory illness promptly so that any MERS incidents can be swiftly contained. Syria and Lebanon, conflict spillover effects. In Syria, now in its 12th year of crisis, public health threats are compounded by economic freefall and fragmented control of territory. While no new epidemics were reported in mid-August, concerns remain about low routine immunization coverage and sporadic disease outbreaks in parts of the country. International agencies are supporting Damascus in developing a new national immunization strategy to regain lost ground on vaccine-preventable diseases, a critical need after polio re-emerged in Syria during the war years. Health infrastructure in many Syrian provinces is being slowly rebuilt. This week, for example, WHO noted progress in rehabilitating primary clinics and re-equipping hospitals in regions that became more stable. However, the northeast and northwest, outside government control, continue to suffer severe shortages of medical supplies, with the recent closure of a UN aid corridor exacerbating the situation. The WHO regional director visited Syria's neighbor Lebanon earlier in August and issued an urgent call for investment in Lebanon's health system, which is buckling under that country's economic crisis and the influx of Syrian refugees. Lebanese hospitals face drug and power shortages, and many doctors and nurses have emigrated. This week saw how regional instability directly affects health. An Israeli airstrike on August 15 in South Lebanon injured several civilians, with Lebanon's health ministry confirming at least one fatality from the incident. Such incidents threaten to drag Lebanon into broader conflict, potentially overwhelming its stretched emergency medical services. Humanitarian groups marked World Humanitarian Day by honoring health workers in Syria and Lebanon who carry hope forward in these trying circumstances. Their message was clear: protecting healthcare delivery amid violence is essential to prevent an even worse public health disaster in the Levant. Wellness and health promotion had numerous developments this week. Saudi Arabia, healthy cities and lifestyle programs. Wellness promotion took center stage in Saudi Arabia's public health agenda this week. With Jeddah and Medina attaining WHO Healthy City status, a testament to initiatives encouraging active lifestyles and healthy urban environments, Saudi officials highlighted the broader Healthy Cities program, improving livability across the kingdom. These efforts involve creating more walkable spaces, parks, and health education at the community level. In Medina, for example, authorities have implemented pedestrian-friendly urban designs and heritage trails that not only beautify the city but also promote physical activity for residents and pilgrims. Additionally, Saudi Arabia's Vision 2030 includes nationwide campaigns to reduce smoking, improve diets, and increase sports participation as part of the Quality of Life initiative. This week, the Saudi National Center for Disease Prevention and Control, WIQAYA, also ran outreach reminding families about healthy eating and weight management, given rising concerns about diabetes and obesity. The kingdom's focus on preventive wellness is yielding recognition, like the WHO accreditations, and is seen as integral to reducing the burden of chronic disease. It illustrates how high-level policy, Vision 2030, is translating into on-the-ground wellness improvements that benefit everyday life. Qatar Summer Health Awareness Campaign. Qatar's Ministry of Public Health rolled out an extensive summer wellness campaign aimed at keeping citizens and residents healthy during the extreme heat and travel season. The campaign, which ran through mid-August, broadcast a series of health tips and guidelines via social media and community outreach. Officials urged the public to remain hydrated, avoid strenuous outdoor exercise during peak heat, and practice sun protection to prevent heat stroke and sunburn. Dr. Salah Al-Yafi, head of MOF's Health Promotion Department, noted that a key goal is to guard against chronic diseases by promoting daily healthy habits even in summer. The messaging emphasized balanced diets, with traditional heavy meals replaced by lighter, hydrating foods, as well as continuing physical activity in safe conditions, for instance, recommending exercise in shaded parks, indoor gyms, or swimming in the evenings. Special advice was given to travelers. The campaign advised those going abroad to get any required vaccinations in advance and to carry sufficient medications and health supplies for their trip. By encouraging Qatar's population to beat the heat safely and remain active, the authorities aim to mitigate summer-related health risks such as heat exhaustion and foodborne illnesses, which tend to rise with the temperatures. The initiative reflects a proactive approach to seasonal wellness, underscoring Qatar's broader commitment to preventive health and community well-being. Oman Community Wellness and Prevention Focus. Oman's newly launched health policy, discussed in the policy section, places health promotion and prevention at its core, and authorities are beginning to socialize these concepts among the public. Over the past week, the Ministry of Health ran an awareness campaign under the slogan, Leading a Healthier Lifestyle, reported via local social media, focusing on combating sedentary behaviors and improving dietary choices. This included radio spots about the benefits of routine checkups and maintaining healthy weight, as well as collaboration with mosques and community centers to spread messages about diabetes prevention and the importance of physical activity. Moreover, Omani health authorities continued nationwide anti-tobacco and road safety campaigns. With Oman's policy explicitly highlighting public health as the central pillar of the health system and pushing for health for all, by all, there is a notable drive to engage communities in wellness initiatives. Primary healthcare clinics have been tasked with ramping up screening programs such as blood pressure and cancer screenings and holding patient education days. One innovative initiative this week was a pilot program in Muscat offering after-dinner neighborhood walking groups led by local nurses, aiming to capitalize on cooler evenings for exercise and social support. Though modest, these programs embody Oman's shift toward health promotion as a collective responsibility of society, not just the healthcare sector. UAE Youth and Preventive Health Empowerment. In the United Arab Emirates, wellness promotion often targets youth and future generations as change agents. This week, the Frontline Heroes Office, a UAE entity supporting healthcare and emergency workers, ran workshops with Emirati youth volunteers to involve them in public health advocacy. Under the theme, Pillars of the Future, young participants engaged in designing mini-campaigns to encourage their peers to adopt healthier lifestyles, such as anti-smoking drives in universities and promoting mental well-being through peer support networks. The UAE has also integrated wellness into its educational curricula. Over the summer break, the Ministry of Education, in partnership with MOHAP, offered school children special sessions on nutrition and the benefits of sports, aligning with the UAE's national well-being strategy. Another highlight is Dubai's upcoming Holistic Health Middle East Forum, announced for October 2025, which is already stirring conversation about integrative wellness, mindfulness, and traditional medicine's role in modern healthcare. Such events indicate the UAE's regional leadership in the burgeoning wellness economy. While not occurring this week, the anticipation and planning for these initiatives were evident in press releases and public statements, reinforcing a continuous narrative of wellness promotion. From workplace wellness programs to citywide fitness challenges, like the popular Dubai 30 by 30 Fitness Month scheduled later in the year, the UAE maintains momentum on health promotion year-round. These efforts contribute to a health-aware society where the emphasis is on staying well, not just treating illness. Bahrain Sports and Wellness Tourism. Bahrain continued leveraging its size and resources to foster a culture of wellness and even position itself as a wellness tourism destination. During this week, Bahrain Sports Ministry and Health Ministry jointly hosted community sports events as part of the Bahrain Wellness Initiative 2025, a series of monthly public fitness gatherings. This week's event was a family cycling day on a closed-off city circuit in Manama, which saw hundreds of families biking together in a safe, festive environment. The event not only encouraged physical activity but also offered free health checks, blood sugar, BMI, and healthy food stalls, a holistic approach to family wellness. Officials announced that due to high interest, such events will increase in frequency. Separately, Bahrain's tourism board is actively promoting the kingdom's spas, traditional hammams, and well-being resorts as part of an Oasis of Wellness campaign targeting international visitors. With the Global Wellness Summit set to convene in Dubai later in the year, Bahraini wellness startups and spa operators are preparing to showcase offerings that blend Bahraini cultural healing practices with modern wellness technology. The integration of wellness international branding is an emerging trend. Bahrain sees potential economic growth in attracting wellness tourism, complementing its healthcare services. Overall, Bahrain's approach to health promotion is two-pronged, improving the health of its own citizens through regular exercise and preventive care, and marketing itself as a haven for restorative wellness travel in the Gulf. Next we have the all-important area of digital health innovation. Saudi Arabia virtual care scaling up. Saudi Arabia's bold investments in digital health are rapidly materializing into concrete services. The kingdom's flagship Seha Virtual Hospital, launched as the world's largest virtual hospital network, continued to expand its reach this week. Saudi officials revealed they are in advanced talks with Bahrain to connect Bahraini hospitals to the Seha Virtual Hospital system, allowing patients in Bahrain to consult Saudi specialists via telemedicine. This cross-border integration would mark a new level of GCC health cooperation via digital platforms. Within Saudi Arabia, Seha Virtual Hospitals network now links over 170 hospitals and offers remote access to specialized consultations in fields like radiology, dermatology, and critical care. Patients in remote areas can visit local clinics and be seen by top experts in Riyadh or Jeddah through live video links, drastically improving access to advanced care. The Health Ministry indicated that daily virtual consultations have increased significantly in 2025, citing telestroke and tele-ICU services that have saved many lives by providing instant expert guidance to frontline doctors. Saudi Arabia is also rolling out an AI-powered triage system in some emergency departments, in partnership with a US tech firm, to prioritize cases more efficiently, an outcome of the national AI strategy that identifies health as a key sector for AI deployment. By embracing telemedicine and AI, Saudi Arabia is enhancing care delivery while aiming to reduce costs and patient travel burdens, especially important given its geographically dispersed population. UAE pioneering AI and digital twin tech. The United Arab Emirates pressed forward with futuristic digital health initiatives. Building on its status as the first nation with a Minister of Artificial Intelligence, the UAE's healthcare sector has piloted the use of digital twins for patient care. In Abu Dhabi, a major hospital reported initial success using digital twin models of patients' organs to simulate treatment options for complex cancer cases. By creating a virtual replica of a patient's anatomy and running precise simulations, doctors can predict outcomes of various interventions and tailor the most effective, least invasive treatment. This technology, still in experimental stages globally, is showing promise in Emirati precision medicine programs. Additionally, Dubai Health Authority announced it is exploring generative AI tools, through a partnership with an American company, to introduce smart virtual nurses that can monitor ICU patients and alert human staff to potential issues. These virtual care assistants, powered by AI algorithms, would augment nursing teams by continuously analyzing patient data and providing decision support. The UAE's robust digital infrastructure and political will have made it a testbed for such cutting-edge solutions. Already, telehealth is mainstream in the Emirates. Thousands of teleconsultations occur weekly through government apps and private providers, a trend that started during COVID-19 and is now entrenched. The focus is now shifting to integration, ensuring electronic health records, EHR, are unified nationally. This week, the UAE inched closer to that goal as MOHAP reported that over 3,000 public and private facilities have been linked into the Riyadh National Unified Medical Record System, enabling health data sharing for better continuity of care. With these strides, the UAE is positioning itself as a global leader in digital health, transforming patient experiences through technology from the clinic to the operating theatre. Oman GCC telemedicine collaboration. Oman took a visionary approach to digital health by proposing a GCC-wide telemedicine platform to manage rare disorders. The idea, discussed at a regional health meeting and publicized in Omani media, is to create an electronic hub where specialists across the Gulf Cooperation Council countries can jointly review and treat complex, rare disease cases remotely. Given that patient numbers for rare diseases in any single country are small, a shared telemedicine network would pool expertise and allow, for example, a genetic disease expert in Muscat to consult on a case in Bahrain or Kuwait. Omani health leaders argue this will further collaboration and improve outcomes for conditions that local doctors might see only once in a career. As a first step, Oman's Ministry of Health this week unveiled plans for a pilot program linking its National Genetics Center with counterparts in the UAE and Saudi Arabia to jointly discuss patient management via secure video consultations. Oman is also leveraging digital solutions for more routine care. It has expanded its Doctor for Every Family mobile app, which now offers teleappointments covering 80% of primary care services, from prescription refills to mental health counseling. Early data show high patient satisfaction and reduced crowding in clinics due to these e-health options. With strong government backing, Oman is integrating digital innovation into its broader health system transformation, ensuring even smaller population countries benefit from the digital revolution in medicine. Bahrain smart hospitals and robotics. Bahrain continue to integrate advanced tech in its healthcare delivery. The newly opened King Hamad American Mission Hospital in ALE has been spotlighted as a model, smart hospital, incorporating AI and Internet of Things, IoT, systems for patient care. This week, hospital administrators detailed how the facility's digital infrastructure allows real-time vital sign monitoring, predictive analytics for patient deterioration, and even AI-assisted diagnostics in radiology. Bahrain's embrace of hospital automation extends to robotics as well. The country was the first in the GCC to deploy robots in clinical settings during the COVID-19 pandemic, for disinfection and medication delivery, and it is now expanding those uses. Bahraini health officials this week recounted how robots equipped with thermal cameras and AI were used to safely triage febrile patients at the height of COVID, reducing infection risks to staff by 80%. Building on that experience, Bahrain plans to introduce robotic nurses to assist in routine tasks like vital checks and laboratory sample transport in its public hospitals later this year. The aim is to free up human nurses for direct patient care and improve efficiency. Additionally, Bahrain's Ministry of Health has been collaborating with Dubai's health authority to share best practices on EHR integration and patient portal development, ensuring patients can access records and telehealth seamlessly across the Gulf. As a result of these initiatives, Bahrain has consistently been ranked among the top e-health adopters in the region. Digital health innovators see Bahrain as an ideal proving ground due to its smaller size and agile regulation. Successful pilots there, like the use of AI for early diabetic retinopathy screening launched this week, can often be scaled to larger countries. In sum, from smart hospitals to cross-border virtual care, Bahrain is punching above its weight in digital health transformation. Lebanon and Palestine e-health in humanitarian settings. In the Levant, digital health efforts face different challenges but still made progress. In Lebanon, despite the economic crisis, telehealth startups have sprung up to offer affordable online doctor consultations and mental health counseling to people who can no longer afford private clinics. One such platform, launched by a Lebanese tech NGO, reported a surge in users this summer as clinic fees skyrocket with inflation. The Ministry of Public Health is cautiously supportive, viewing telehealth as a stopgap to maintain access, especially in rural areas where many physicians have left. However, connectivity and power outages remain issues. In the West Bank, the Palestinian Ministry of Health this week expanded a pilot mobile clinic system that uses telemedicine. Doctors in Ramallah remotely guide community health workers in isolated villages via tablet computers to perform basic examinations and even ultrasound scans. This project, aided by UNICEF, has improved maternal and child health coverage in Area C communities with limited clinic access. In Gaza, of course, the digital infrastructure is severely compromised by ongoing conflict. Nevertheless, Palestinian tech volunteers have set up an emergency telemedicine hotline, using WhatsApp and other encrypted apps, where diaspora doctors provide advice to overwhelmed Gazan medics when possible. While far from the high-tech landscape of the Gulf, these examples show digital ingenuity being applied to health needs even under duress, and they lay a foundation that could be scaled if conditions stabilize. International donors are keen to support digital health in these settings as cost-effective means to bridge gaps. If electricity and internet connectivity can be sustained, telehealth may become a lifeline in places like Lebanon, Syria, and Palestine to mitigate some impacts of the healthcare crises there. Hospitals had a number of key developments we'll discuss now. UAE Center of Excellence accreditations. The UAE's reputation for world-class hospital care was reinforced by a notable accreditation in Dubai. Mediclinic City Hospital in Dubai Healthcare City announced that it has been designated as a center of excellence in surgical proctology by the US-based Surgical Review Corporation, SRC. Awarded on August 19, this elite status recognizes Mediclinic's high standards in diagnosing and treating colorectal and pelvic floor disorders. It is a milestone both for the hospital and the region, as it affirms Mediclinic's leading role in specialized surgical care. The accomplishment was spearheaded by Dr. Valentina Jakalia, Deputy Medical Director and Consultant Colorectal Surgeon, who also became the first female surgeon globally to earn SRC's Surgeon of Excellence in Proctology Award. Her achievement reflects the depth of expertise at Mediclinic and highlights the rising prominence of female surgical leaders in the Middle East. The hospital's proctology unit is staffed by a multidisciplinary team, from colorectal surgeons to physiotherapists, ensuring comprehensive, personalized care that earned praise from Dubai Healthcare City Authority for advancing UAE healthcare innovation. This follows similar successes earlier in the year, such as Saudi German Hospital Dubai attaining an SRC Center of Excellence in Proctology, the world's first, in the spring. These accreditations signal that Gulf hospitals are not only meeting but setting global benchmarks in subspecialties, boosting medical tourism and local patient confidence. Jordan New hospital and digital infrastructure investments. Jordan is moving ahead on major hospital infrastructure projects aimed at upgrading its healthcare delivery. Over the past month, the government finalized agreements with investors to build the new Madar Government Hospital, Jordan's first public hospital constructed via a public-private partnership in a decade. At a ceremony witnessed by the Prime Minister and a Saudi investor prince, it was confirmed the hospital will have an initial capacity of 260 beds, expandable to 360, and state-of-the-art surgical and diagnostic facilities, with construction expected to take 3 years. The facility will include multiple operating theaters, intensive care units, and a full range of specialty clinics, addressing a critical gap in the growing Madar Governorate. Under the deal, the private partner will finance and build the 13-story hospital, while the Ministry of Health will fully operate it upon completion. Jordan also inked a contract to digitize the Royal Medical Services, the military healthcare system, implementing an advanced supply chain and health information system across all army hospitals. This digital transformation aims to improve drug inventory control, reduce wastage, and speed up laboratory and radiology workflows in military hospitals, which serve a large segment of the population. Together, these projects, valued at $187 million, represent one of the largest injections of capital into Jordan's health sector in years. This week, preliminary site works and planning commenced for the Madar Hospital, and the RMS digital project kicked off with vendor teams assessing current systems. If all proceeds to plan, Jordan can expect a significant boost in hospital capacity and efficiency by the late 2020s, alleviating overcrowding and bringing high-quality care closer to underserved communities. Gulf private hospital expansion. Elsewhere in the Gulf, private healthcare groups continue to expand their hospital networks to meet growing demand. In the UAE, NMC Healthcare and VPS Healthcare both announced mid-August progress on new hospital projects, including a 100-bed multi-specialty hospital in Sharjah set to open by year's end and an oncology center of excellence in Abu Dhabi under construction. Bahrain similarly saw its private sector grow. Royal Bahrain Hospital opened a new satellite clinic on August 15 as part of its strategy to bring primary and specialist services to different neighborhoods. Qatar is in the process of commissioning additional facilities ahead of expected population growth. This week, Hamad Medical Corporation, HMC, noted that the new trauma and emergency center in Doha is now fully operational, significantly boosting emergency bed capacity. HMC also revealed that its Northfield Hospital project, to serve the expanded industrial workforce in Ras Laffan, reached 50% completion. Kuwait, following recent healthcare scandals like the methanol poisonings, is investing in upgrading public hospital emergency departments and considering contracting international hospital management firms to improve service delivery. The sum of these developments indicates a robust trend. Hospital infrastructure across the Middle East is expanding and modernizing, through both public funding and private investment. However, challenges remain in staffing these new facilities. Many countries are recruiting nurses and doctors from abroad to fill gaps, even as they train more local medical graduates. The region's hospital sector is thus in a dynamic phase of growth, racing to keep up with population health needs and government aspirations for medical excellence. Let's finish with population health management. Iraq, prioritizing women's, children's, and adolescents' health. Iraq's launch of its comprehensive 2025 to 2030 strategy for women, children, and adolescent health represents a pivotal shift towards systematic population health management. Developed with WHO, UNICEF, and UNFPA support, this strategy identifies these demographic groups as top priorities and lays out targeted interventions to improve health outcomes. For women of childbearing age, the plan calls for expanding maternal health services, for example, more antenatal clinics and skilled birth attendants even in remote districts, and addressing issues like high anemia rates via nutrition programs. For children, Iraq will focus on boosting immunization coverage, aiming to reach every child with routine vaccines and catch-up campaigns, since recent conflicts left immunity gaps. Community health worker programs are set to be scaled up to deliver basic child health care and educate families on hygiene and disease prevention, especially in underserved rural and post-conflict communities. Adolescents, often overlooked, are explicitly included. The strategy proposes adolescent-friendly health centers to provide counseling, mental health support, and reproductive health education for youth. Underpinning all this, Iraq is strengthening its health information systems to better track health indicators and ensure data-driven policy. With a fully budgeted action plan, the government has begun mobilizing resources this week. For example, training workshops were held for provincial health directors on implementing the new strategy's guidelines. WHO praised Iraq's commitment, noting that if executed effectively, this could significantly reduce maternal and child mortality and improve the overall health trajectory of the next generation. The strategy's multi-sectoral approach, including clean water, education, and nutrition initiatives in coordination with other ministries, exemplifies modern population health management, moving beyond siloed healthcare to broader determinants of health. Syria rebuilding immunization and primary care. Amid relative calm in parts of Syria, efforts are underway to rebuild population health programs that deteriorated during the war. A major focus is on immunization. The Syrian Ministry of Health, with UNICEF and WHO, ran a national immunization campaign around World Immunization Week earlier in the year, aiming to reach 3.4 million children under 5 with missed routine vaccines. The campaign specifically targeted zero-dose children, those who had never been vaccinated, across all 14 governorates, including hard-to-reach areas, to combat outbreaks of polio, measles, and diphtheria. In August, follow-up, mop-up, rounds continued in the northeast and northwest, where health workers carried coolers on motorcycles and donkeys to remote villages. Initial results show improved vaccine coverage in previously rebel-held regions, though nationwide rates are still below pre-war levels. Concurrently, Syria is working on a new national immunization strategy as part of its health recovery plan, expected to be published later in 2025, which will outline how to restore and sustain high immunization coverage through 2030. Another population health area is primary healthcare rejuvenation. Syria, with support from whose Eastern Mediterranean Regional Office, has reopened dozens of primary health centers and is training a new cadre of community health volunteers. These volunteers are being taught to manage common conditions, like diarrhea, respiratory infections, basic antenatal care, and refer serious cases up the chain. On August 19, World Humanitarian Day, WHO honored Syrian health workers for their perseverance and highlighted the need for continued global support to sustain these vital population health services. If stability holds, Syria hopes to integrate these emergency measures into a cohesive public health system. The emphasis is on ensuring every Syrian has access to basic preventive and primary care, a cornerstone of improving population health after years of crisis. Egypt, mass health campaigns and screening programs. Egypt's 100 Days of Health initiative, launched in mid-July, exemplifies a broad population health campaign addressing multiple health priorities simultaneously. In its first month, the campaign operated nationwide mobile clinics, health caravans, and public outreach events, delivering tens of millions of free health services ranging from screenings to treatments. By mid-August, the Health Ministry indicated that the campaign's third phase had provided over 50 million services, including preventive screenings for diabetes and hypertension, dentistry checkups, family planning services, and even minor surgical interventions, all at no cost to citizens. These figures, while astonishing, reflect Egypt's ability to mobilize vast resources for short-term intensive public health drives, a model previously seen in its hepatitis C elimination campaign. The government deploys thousands of doctors and nurses in rotating field teams to reach both urban slums and rural villages. For example, this week one focus was on childhood nutrition. Teams screened children for stunting and anemia and distributed vitamins in Upper Egypt provinces. Another component targeted women's health. Mobile units offered breast cancer screenings and OB/GYN consultations, and at last count over 1.3 million women have been examined for breast cancer since the campaign's start, with referrals for any suspected cases to hospitals. While resource-intensive, these approaches have yielded measurable successes, for example, dramatic declines in hepatitis C prevalence. Public health experts observe that Egypt's model, if aligned with strengthening of routine primary care, could significantly improve health outcomes in a relatively short span, given the political commitment and scale of operations. GCC Healthier Populations via Policy. Across the Gulf Cooperation Council states, beyond acute care, governments are implementing policies to manage health at the population level by addressing risk factors and social determinants. Saudi Arabia, for example, has rolled out taxes on sugary drinks and tobacco in recent years, and early this week the Saudi cabinet discussed further regulations on marketing unhealthy foods to children, all part of a strategy to curb rising non-communicable diseases. Kuwait just introduced new rules banning trans fats in all food outlets effective 2025 and is enforcing school cafeteria nutrition standards. Qatar and UAE have each set targets to reduce national obesity and smoking rates by specific percentages by 2030, and are actively monitoring progress through annual health surveys. In line with those goals, Abu Dhabi's Public Health Center launched a pilot on August 16 using wearable fitness trackers provided to 5,000 volunteers to gather data on physical activity patterns, which will inform future community interventions. Additionally, regional cooperation is in play. The GCC Task Force on Public Health met virtually on August 17 to share best practices on managing population health data and to plan a GCC-wide campaign against hypertension slated for World Heart Day in September. This kind of regional alignment helps smaller states benefit from the successes of larger ones. For instance, Bahrain and Oman are adapting some Saudi health education materials for their own use. The overarching theme is that Middle Eastern countries are increasingly treating health promotion and disease prevention as a collective, population-level endeavor, employing policies, technology, and community programs to keep their people healthier and ease the burden on health systems. The sustained focus and political will seen in these initiatives suggest a promising trend toward better population health management outcomes in the future. So let's summarize this week's review. The week of August 14 through the 20th demonstrated a Middle East health sector in dynamic transition. On one hand, countries are proactively shaping healthier futures through bold government strategies, cross-sector partnerships, and leaps in science and technology. From Oman's comprehensive new health policy to Iraq's targeted maternal and child health plan, policymakers are embedding prevention and equity into the fabric of their systems. The Gulf states in particular are leveraging wealth and innovation to redefine healthcare delivery, connecting patients across borders virtually, localizing production of life-saving drugs and devices, and attaining global accolades for care quality. These developments speak to a region increasingly confident in steering its own health destiny and sharing its models abroad. At the same time, the enduring hardships in conflict zones and resource-poor areas cast a long shadow. The collapse of Gaza's health system and Yemen's ongoing humanitarian crisis are sober reminders that stability and peace remain prerequisites for health and wellness. They also underscore the necessity of international solidarity and sustained aid, without which millions will continue to suffer from preventable illnesses and lack of care. The juxtaposition of high-tech telemedicine in Riyadh and field hospitals struggling under siege in Gaza captures the region's stark disparities. In conclusion, the Middle East's health and wellness domain is marked by both inspiring strides and continued needs. The narrative of this week of newborns saved through screening in Dubai, surgeons innovating in Riyadh, families biking for wellness in Manama, but also of doctors pleading for supplies in Gaza and cholera patients in Sana'a encapsulates the region's complex journey. The clear takeaway is that health has risen to the top of national priorities across the Middle East, seen not only as a human necessity but as a cornerstone of social stability and economic vitality. With continued commitment, smart partnerships, and a bit of luck for peace, the region can aspire to a future where all its diverse populations enjoy the fruits of these ongoing health transformations. The coming weeks will undoubtedly bring new challenges and achievements, and we will continue to monitor and chronicle the Middle East's remarkable health story as it unfolds. For more information about any of the topics discussed here, or if you would like to learn more about Al-Ghaf Dynamics and our extensive range of services and solutions in healthcare, life sciences, and wellness for the Middle East, please don't hesitate to contact us. Visit us at our website or email us directly. Additionally, scan our QR code for all our links. Thank you for listening and see you next week.